Today we're going to be talking about lovastatin and its pathway to inhibit cholesterol. Okay, so cholesterol is a lipid molecule that's vital for the structural integrity of cell membranes, the synthesis of steroid hormones like estrogen and testosterone, and the production of bile acids that's necessary for fat digestion. Our body gets cholesterol from two primary sources: dietary intake, so foods like meat, dairy, and eggs, and endogenous synthesis, so that's mainly in the liver. While cholesterol is essential, too much of it can lead to serious health issues. High levels of low-density lipoprotein, also known as LDL cholesterol, and it's also referred to as a bad cholesterol, can contribute to the formation of atherosclerotic plaques in the arteries, and this leads to a condition known as atherosclerosis. Atherosclerosis can significantly increase the risk of cardiovascular diseases, including heart attack, strokes, and peripheral artery disease. To illustrate the severity, it's worth noting that cardiovascular diseases are the leading cause of death worldwide, and the World Health Organization estimates that over 17 million people die from CVDs each year. Given the risk associated with high cholesterol, pharmacological interventions become critical for those to manage their cholesterol levels through the diet and lifestyle changes alone. There's also medications, and those include statins, including lovastatin, which we'll talk about today. These have been proven to be highly effective in reducing cholesterol levels and thereby lowering the risk of cardiovascular events. All right, so cholesterol biosynthesis, also known as melvanate pathway, is a complex multi-step process, and this occurs primarily in the liver. This pathway involves the conversion of acetyl-CoA into cholesterol through a series of enzymatic reactions. The pathway begins with the condensation of two molecules of acetyl-CoA to form acetoacetyl-CoA. This is followed by the addition of a third acetyl-CoA molecule to produce 3-hydroxy-3-methylglutaryl-CoA, or also known as HMG-CoA. The enzymes that do this is thiolase and HMG-CoA synthase. So HMG-CoA is then reduced to melvanate by the enzyme HMG-CoA reductase. This is the rate-limiting step of the cholesterol biosynthesis and is a critical control point in the pathway. Melvanate then undergoes phosphorylation and decarboxylation to form isopentenyl pyrophosphate, which is IPP, and then this is activated into an isoprene unit. IPP isomerizes to dimethyl pyrophosphate, also known as DMAPP, and these isoprenoid units undergo a series of condensations to form geranyl pyrophosphate, or GPP, and farnesyl pyrophosphate, or FPP, and then finally squalene. The enzymes in this pathway are isopentenyl pyrophosphate isomerase, and then geranyl transferase and squalene synthase. So then squalene undergoes cyclization to form linesterol, which is a key intermediate in the biosynthesized cholesterol, and this enzyme is squalene epoxidase and ion sterol synthase. Linesterol then undergoes a series of 19 additional reactions, including demethyl reduction and isomerization, and this produces cholesterol. The activity of HMG-CoA reductase is tightly regulated by a feedback inhibition, so high levels of cholesterol and its derivatives inhibit the enzyme, therefore reducing the synthesis of cholesterol. Insulin and glycogen also regulate the activity of HMG-CoA reductase, and insulin promotes the activity of the enzyme while glucagon inhibits it. Drugs like lovastatin mimic the structure of HMG-CoA and acts as a competitive inhibitor, which we'll talk about on the next slide. Okay, so lovastatin is a member of the statin class of drugs, which are primarily used to lower cholesterol levels in the blood. It's derived from the fermentation of a product of a fungus called Aspergillus terreus. Lovastatin was one of the first statins discovered and has been widely used since its approval by the FDA in 1987. Lovastatin targets the enzyme HMG-CoA reductase, which is the rate-limiting enzyme in the cholesterol biosynthesis pathway. Lovastatin works as a competitive inhibitor of HMG-CoA reductase. It mimics the structure of the natural substrate HMG-CoA, thereby binding to the active site of the enzyme and preventing it from catalyzing the conversion of HMG-CoA to melvanate, and this is an early and crucial step in cholesterol synthesis. So by inhibiting HMG-CoA reductase, lovastatin reduces the overall production of cholesterol in the liver. This leads to an upregulation of LDL receptors on hepatocyte surfaces, increasing the uptake of LDL cholesterol from the blood and thereby lowering plasma cholesterol levels. Lovastatin is initially administered as a lactone prodrug, so once ingested, it undergoes hydrolysis in the liver to its active beta hydroxyacid form, which is the actual inhibitor of this HMG-CoA reductase. Lovastatin is prescribed to patients with hypercholesterolemia, which is the high cholesterol levels, to reduce the risk of cardiovascular events such as heart attacks and strokes. It's also used in patients with existing coronary artery disease to reduce the risk of further complications. Lovastatin is typically administered orally and is in various dosage forms. It's often recommended to be taken with an evening meal, as cholesterol synthesis in the liver is more active at night. Okay, so lovastatin is primarily prescribed, again, for the treatment of high cholesterol, and particularly in cases where diet and lifestyle changes alone are not enough to lower cholesterol levels. Lovastatin is effective in reducing the risk of cardiovascular events such as heart attacks and strokes. By lowering the LDL cholesterol levels, it helps to prevent the formation and progression of atherosclerotic plaques in the arteries. Additionally, for patients with existing coronary artery disease, lovastatin reduces the risk of further cardiovascular events, thereby improving long-term outcomes. Beyond cholesterol-lowering properties, lovastatin has also been shown to exert anti-inflammatory effects, and this can further contribute to cardiovascular protection. So one of these on this graph here, it'll show you randomization studies, and then it'll show you like controlled trials, and you'll see that the magnitude of exposure to LDL is lower when any type of statin drug has been taken, particularly the lovastatin drug. Okay, so we explored the complex pathway of cholesterol biosynthesis and highlighted the critical role of HMG-CoA and reductase in regulating cholesterol levels. And then we discussed how lovastatin is, which is a statin drug, competitively inhibits HMG-CoA reductase, thereby reducing cholesterol synthesis in the liver. The benefits of lovastatin is managing hypocholesterolemia and reducing the risk of cardiovascular events, along with potential additional health benefits. So statins like lovastatin have revolutionized the treatment of hypocholesterolemia, offering a powerful tool to help patients achieve healthier cholesterol levels and improve overall cardiovascular health. Research continues to explore new statins and combination therapies to further enhance cholesterol-lowering effects and minimize side effects. The future of cholesterol management may include personalized approaches tailored to individual genetic profiles, specific health needs, ensuring the most effective and safe treatment for each patient. While medicines like lovastatin are essential, a holistic approach that includes a balanced diet, regular exercise, and healthy life choices is almost as important for optimal cardiovascular health.